Good afternoon and welcome to the Westport Board of Health March 17th, 2025 meeting, which I'm calling to order with a happy St. Patrick's Day to everyone. Thank you to Donna for our festivities here. Under Mass General Law, Chapter 30A, Section 20F, this meeting is being recorded. And please join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, we will start off. Get this live with the director. Come on. Directors. Why am I not? Directors report, there it is. Matt's written report. Any questions on that?
I had none.
No.
Then we'll go to the verbal update from Matt.
Okay, so you can see the blood drives have started for 2025, and I've outlined them here. The next one is on March 20th, which I believe is this coming Thursday, and it's from 9 a.m. to 3:30 p.m.
Over at St. John the Baptist.
St. John the Baptist Church, yes. April 17th, May 15th, June 12th, and July 17th are the ones that we have scheduled at the moment, all at St. John's the Baptist Church. The new transfer station foreman had started on March 13th. We're in the process of filling an on-call animal control officer position for the remainder of FY25. I've already interviewed a few candidates and we'll be making a decision soon. The position will be through a temp agency, but given the uncertainty surrounding, just because we're uncertain about the FY26 budget for the part-time ACO position. So basically, we're going to bring somebody in on a temporary basis through an agency, see what happens at town meeting, and then hopefully we get the budget approved and the position approved, and we can move forward into FY26 with it.
As you recall, we originally did not have the part-time ACO in the budget, but there's been some negotiation with the Finance Committee and the Town Administrator, and we believe some lower amount, but some amount is in there, so we hope that's approved.
And when I did talk to the Town Administrator, Nick is covering, but he's covering everything, and it's I think it's just starting to weigh down. He's on call 5 days a week, every other weekend, and just to keep sustaining that, we want to be able to, we should have a second person. It's not reasonable to ask somebody to do it 24/7, 7 days a week, all the time. So I think it's a good move, and it'll be good for the town to have the coverage.
Free Nick.
Yeah.
Yeah, right. I will say that issue was brought up. There have been some candidate forum meetings, and that was one of the issues that was addressed about the budget and needing people. And they specifically spoke about Nick and how much Nick has been working. Shauna addressed he works 24/7. He's, we really need, our budget needs to accommodate or include an additional help. We are on a shoestring. So she specifically mentioned Nick and animal control.
Okay, so the state had been putting out some new drought warnings, and it's been nearly 7 months of below normal precipitation. Even with all the rain we've gotten in the last 24 hours, it's not even going to make a dent. So as a result, critical and significant drought conditions persist all across the state. And in our area, we're still labeled as level 2 significant drought, where it looks like the entire middle of the state, even up on the North Shore, is in a critical drought. And yeah, hopefully we get some good amount of rains to come out of this, come out of the drought. So unfortunately, measles cases continue to surge in 2025. And this is at the time of when I wrote this report, with over 220 measles cases reported by March 6th by 12 jurisdictions, including New York City and Rhode Island. The data is it's evolving rapidly and likely to increase over the next few weeks. The majority of the cases are associated with a large outbreak among the unvaccinated, young children in the South Plains region of West Texas, which is 32% of the cases in West Texas, are all children under 5 years of age. 45% are in youth between the ages of 5 and 17, and 97% of the cases are not vaccinated or have an unknown vaccination status. The outbreak in Texas has received a good deal of media attention, which in turn has created concern in Massachusetts about the susceptibility to measles among those traveling to Texas, traveling internationally, or generalized concern irrespective of travel. So it sounds like, not just sounds like, it is, the best way to protect yourself is to get vaccinated. I think it covers 93 to 97% of coverage. So
Yes, and the thing about measles is it is one of the most highly contagious viruses that we know. That one person can infect 18 people with any presentation of symptom. So initially the symptoms look like a cold. The person will cough, the person will have a runny nose. But that person is contagious, and any cough will spread it in, I don't know what the parameter is, but it's incredibly contagious, and it can advance to not just those symptoms, but then a rash, and then goes to infecting lung, so there can be inflammation in lung, inflammation in brain, so there can be encephalitis, and some of the long-term effects for children are hearing loss and some intellectual incapacitation. And of course, the worst thing is death. And we know that there have been 2 cases of one child and one adult, I believe, that died because of measles down in, I think it was in Texas, but it was down south. So I think people need to think, oh, it's just, it's just a rash. It's not just a rash. It goes into the internal systems and can cause inflammation and really long-lasting problems, especially for children.
in the, like mentioned, the CDC states that 2 doses of the MMR vaccine is about 97% effective at preventing measles, and the protection is long-lasting. 1 dose is about 93% effective. Schools, early childhood education providers, and healthcare providers should work to ensure patients are current with the MMR vaccine. And you can go to the CDC and just click on the measles-specific vaccination to get more information.
But Matt, this is for people who were not, vaccinated when they were children. Or are you saying that people should go and get like a booster shot?
It didn't say they needed, this wasn't about a booster, this was about just unvaccinated.
Unvaccinated,
Yeah.
Okay, because I think it lasts a really long time.
It does.
Your body
I
creates
can
the
recall
immunity.
some after some time, especially if you're traveling to other countries,
Yeah.
that a booster. I know that when I traveled, I don't know if it was to South America or Africa, but some boosters were recommended, and so I got the boosters
Yeah.
as an older person going on a trip.
And okay, so the first National One Health Plan was released. So the CDC and Prevention, the U.S. Department of Agriculture, and the Department of Interior released the first ever National One Health Framework to address zoonotic diseases and advance public health preparedness in the United States, 2025 to 2029. One Health is a collaborative, multi-sectoral, and transdisciplinary approach with the goal of achieving optimal health outcomes that recognizes the interconnection between peoples, animals, plants, and their shared environment. I thought it was an interesting concept, and you go to the CDC webpage and click on the framework for this, and gives you some good information.
Do they still have a webpage?
So it still hasn't been taken down yet, to my knowledge. So
Checking.
Can you just help the general public with the zoonotic diseases is diseases transmitted from animals to
humans, yeah.
Just make note too as changes, that's a good point, Bill, as changes may occur with the CDC and other federal agencies, that some of the other organizations are stepping up. One of them is the American Medical Association, so that they're also looking at information and providing information as well for us to hopefully follow so that we stay well.
Okay, thank you. Next on the agenda is director approved plans. We have one, and I'll turn it over to Matt.
Well, so we have just one director approved plan for 1489 Main Road on a 113,256 square foot lot. It's a repair of a 4-bedroom. It already has an existing singular system. They're connecting an ADU into this existing system, which was, I believe, a 3-bedroom house designed for 4 with the singular, and they're just connecting this ADU into it.
Okay. Any questions? Okay.
So I move that we endorse the director approved plan for 1489 Main Road.
Second.
Motion made and seconded to endorse that plan for 1489 Main Road. All in favor?
Aye.
Aye, that's unanimous, thank you. Okay, we're moving on to minutes, which I keep on forgetting, I don't have a paper
That's right.
packet.
It's an adjustment.
Okay, we have the minutes of 1/22/25.
I have no issues with minutes.
Can we
Me
just,
neither.
Bob, can we just fix the spelling of my first name?
Oh,
Tanja. Yeah. Sorry, I make it difficult, but you got it right on the end. The signature page is fine. Okay, seeing no concerns, I take a motion to approve the January
so
22nd.
moved.
Second.
All in favor?
Aye.
That's unanimous. Okay, the next one is
February 11th.
22nd, February 11th. Same
no issue.
spelling.
I have no issue except for Tanya's name, which really isn't my issue.
Yep. Signature page is fine, so. Okay, I'll take a motion to approve.
So moved.
Second.
All in favor?
Aye.
That's unanimous, thank you. Okay, we're moving on to other business. And just an FYI that we have time because the 420 discussion has been, they will not be coming in. They presented a written documentation of their plans to come into compliance. So we have 15 minutes to review this stuff. Our first agenda item under other business is transfer station fee schedule review. And we all have paper copies because I accidentally missed the electronic. And I'm going to turn it over to Matt for a discussion.
So our bulky waste, our C&D, the tonnage rates continue to go up, and now they've gone up to a point where we need to raise our fees to keep up, to stay within budget and not get too deep in the hole here. So I've just drafted a proposal just for those particular items that would go into the bulky or the C&D dumpster, the sofas and the love seats and the carpets and tables, chairs. Also, people come in with trunk loads or truck loads. We've updated that accordingly. And the tires have gone up quite a bit. We brought a dumpster down. Well, last year, for instance, we brought a dumpster down, and the invoice was $750. This year we brought a dumpster down and the invoice was $1,750.
Wow.
Whoa.
And it wasn't a typo because I called. So we need to go up on the tire prices a little bit to keep up with that increase.
Are the price increases enough, you think?
They're enough because, well, I don't know if there'll be enough. I don't think we can really say. It depends how many, tires we bring down. We, at one point we were bringing them down twice a year. This year we brought it down once in a 12-month period. So I think we'll be okay with these increases.
Okay.
I didn't want to go too high because I don't want to start finding tires all over the side of the road.
Right,
So,
yeah, okay. And just that we're adding smoke CO detectors to the disposal list for $25.
Right, that's what we pay, and
We're
for
not-
years they haven't been included. They get picked up when they pick up our other hard to manage items with the mercury,
Yeah.
and we get a giant container full of these when they pick them up, and at $25 a piece they add up, and it's a significant amount of money that we're paying. So we got to try to recoup some of those funds. Last week I took a tour of the facility up in Fall River on Airport Road. They come down and they pick up all of our CRTs, and I asked, why does it cost so much for the smoke detectors? It's because they're considered radioactive and they have to go to a special facility, and there's a lot of money to handle those items.
But it's important to have smoke detectors and CO detectors in your house, so,
Yes.
okay. All right, any questions about the fees, or anything you want to point out?
No, but I have a question that's not really related to the fees. Is that recycling, does that include that event that's going to happen in March? Do you know if it includes that? So
Smoke detectors.
Smoke detectors.
As far as I know, it doesn't.
Yeah.
It's more like computers, printers, appliances.
So it might be a public service announcement to have people bring that, so it wouldn't cost them as much.
Yeah, in fact, I thought the fees were more expensive for that. But there is and I'm sorry I didn't bring the flyer that I got in the mail. Hopefully everybody did, Westport residents. Our local state rep and senator and are sponsoring, along with Eversource and NSTAR, or National Grid, a recycling event that will be at the old high school on March 29th from 9 to noon. We'll get information up on the website about that in case people are interested in that. And especially if they don't have a sticker to go into the dump, they can bring some of their items there. And what are we proposing for effective date for these new fees?
I would propose April 1st.
Okay.
So
Do we have to, these are just increasing fees. Do we have to do a public, what do we have to do?
because we're not changing like any categories or creating a new fee schedule, we generally don't. But that's up to the board. But we have not in the past when it came to the transfer station fee schedule.
Okay. All right.
And I don't know that it would be, do you have the electronic sign down there?
Yep.
Would that be something you would want to advertise? There'll be some increase.
Yep.
Yeah, we'll definitely get that on the sign starting April 1st. We'll come up with a message, so hopefully we can just keep it on one screen.
Yeah. And we can rotate so that there's some, like, 1 week fees, because most people go pretty regularly. Any concerns about April 1st? Otherwise,
Is it enough time to notify people?
Yeah, it's half a month away.
2 weeks, yeah.
Okay.
Okay, I would take a motion to approve the new fee schedule for the transfer station and recycling center effective April 1st.
So moved.
Second?
Motion made and second to approve the new fee schedule. All in favor?
Aye.
Aye, that's unanimous. Thank you. Agenda item number 2, I'm going to let Matt discuss that, or I know we have it's still in process, so we may not have anything final yet.
So the transfer station improvement plan, last time we talked about it, we was to update the signage. Since then, and that was only a fraction of the $75,000 that we were allotted for the transfer station improvements. Since then, I've reached out to Chris Gonsalves at the Highway Department to help. He has a contract already with some paving people to give us a price to, how much it would do to pave some of the unpaved areas at the transfer station. They came down, took all the measurements, but I'm still waiting to get the price back. I haven't. It's been maybe a couple weeks at this point, and when I reached out to Chris today, he wasn't available. So we'll try again this week to reach out to Chris and see where that stands. Because we have to have, whatever we do, we have to have it, I have to resubmit a scope of work over to DEP, then the contract's gonna come back and it's gonna get signed, and we have to have the work complete by June 30th.
And the idea is to pave the area where those sheds are currently,
Yeah.
the recycling sheds, and perhaps if there's enough money to replace one or two of those. They're looking pretty ratty.
Yeah, and pave the area down below where the Scouts and Bike recycling is.
Mm-hmm.
There's a couple other small spots, like where the employees park, we want to have paved. Right next to the new shed, there's a dirt area where Stephanie generally parks. So, and there's some repair that needs to be done. From where the water runs down from the drainage, it's starting to get like this, and we want to even that out again. So there's quite a bit of repair work that can be done. It's just a matter of, we're going to get the pricing back and talk with these folks about it.
Yeah, okay. Any concern about the amount of impervious surface area increasing?
I don't know. I don't think we got so much impervious surface area. I think, I don't think it's going to matter, but I'll check with Chris and over in Concom and look at the regs, the transfer station regs, and see if we're required to keep a certain percentage of impervious area.
Okay. I would, because I didn't,
I just have a question about it as well. I mean, I haven't really put a lot of energy into this, but one of the things that was brought up was about the potential of putting a composting area and doing composting at the transfer station. Do we have any idea where, if we were going to do that, where we might put that?
We talking food composting?
Yeah.
No, I didn't put much thought into it either.
I've been focusing more of my energy on the opioid settlement fund advisory committee, but as we're talking about transfer station improvement plan and looking at that, thinking about if we were to get some feedback from the community that this is really something they would want, then where would we think about putting that?
Right, and I think I have thought about it a little bit, I should say, and it's just managing it and how we're going to manage it, who's going to manage it. So I think it's pretty easy. I could come up with a pretty easy location way to put it. It's just the complicated piece is who's going to manage it,
right,
and how they're going to manage it.
I did visit the little Compton facility, and they do have somebody there kind of keeping track of it, so it would need to be in a place where the staff are located.
Right, okay.
So.
Just wanted to throw that out there because
Yeah.
it made me think about starting to work on that.
As we get into the warmer weather.
Yes.
Okay. Schedule a working meeting. Actually, we do need to talk a little briefly about the 420 discussion before we go into 430. So we wanted to, I know Phil has been working on well regulations. We wanted to do an update on that. Maybe ADUs related stuff.
Hopefully the guidance will be out, by then. But this relates to
Guidance for wells or guidance
no,
for
guidance for
ADU?
the ADU stuff.
ADU.
Will be formal.
Yep.
And I can talk a little bit about that in the.
And then I'm interested in like the O&M stuff for IA systems. We're hearing people
Come out. But then I guess it depends on the first topic being the water well regs. It just kind of depends on either how much work that Matt and I do before I leave, or giving lead time when I can come back to put in some more work, if and kind of figuring out what we want to accomplish at the at the working meeting, because we're still working through the language and some of the concepts of how we want to approach these just at the front end of the process part of it. There's some other more complicated, so to speak, things to do, and then Matt and I have been talking about actually meeting with a well driller, just to get a field frame of reference as to how, what actually the well drillers are looking at, and it doesn't seem, there's no, it's kind of like town by town, and as I said before, the towns, each town, takes it kind of differently. So just to get a frame of reference, because we're going from almost no regulation to much more guidance in our regulation as to what we're expecting. And I'd like to get some reaction to that,
Okay.
before
So
we
is
really
the,
go public.
okay,
Not that we're ready to do that, but
all right.
you would have legitimate questions to ask, and I think this is a little bit for Matt, both of us would say, well, we don't really know, because it's
Okay.
not like septic systems, which we're kind of immersed in, how wells get drilled, and the light touch we have on regulating them now
Well,
leaves us. So,
okay, it may not be until May then.
okay, because your other folks are away in April. Yeah.
Yeah, are you back on the 14th? Will you be back for the meeting?
I'm actually
Returning that day.
returning that day, so I wouldn't be down, and it's at night, so I wouldn't be down until the 15th.
Okay. We may have to jigger that schedule on the 14th, because I have
There is
medical stuff before then.
There is an issue that Matt and I have talked about, which I don't know that, maybe it could go under the unanticipated items rather than bringing it up now. But this has to do with to what extent we're going to give guidance to the ZBA on the Westport Lakes project. And
Well, we haven't gotten anything from them yet, have we?
We haven't received anything for me to review.
right,
So,
So I think that's premature
yeah,
at this point.
right, okay.
But
Well, I know that they're having their hearing on the 15th. Oh, no, it's not until June, right? No, there's a hearing that they're having.
I think
in
it's April 19th, I think. I have to
April
double
19th.
they
check.
have to give
Yeah.
us 30 days notice, though.
Yeah,
They're supposed to.
yeah, yeah.
Okay, well, we better follow up on that. Okay, it is 4:30, why don't we take a pause here? We'll come back to figuring out a date and board member updates
Okay.
after our appointments, because I don't want to hold people up on that. So we'll return to those items. I'm going to pass over the discussion about 666 Sodom Road. Matt can give us an update on that again after our appointments. And we'll start. I will call the 4:30 variance hearing for Len Potter for 10D Drive, representing the Thomas Hancock Estate 3-bedroom repair with a quick 4 on a 10,500 square foot lot.
Good afternoon.
Good afternoon, Mr. Potter.
Glenn Potter here for Tom Hancock Estate. Septic system repair at 10G Drive. And we have a small lot, 10,500 square feet. Currently has a cesspool. So that's in the rear of the house, wells out front. The proposed system is adequate for a 3-bedroom house. My intent is to install a septic tank, as you can see, and pipe it to a D-box. and that's pretty much it. And the wells are located, can you hear me?
Just to make sure.
The wells, all the wells in surrounding lots are 100 feet away. The owner's lot is 61 feet to the proposed area. And the water was tested, and the water was fine, except the nitrates were at 8 milligrams per liter, if I'm correct. Check the result.
Lead was right at the limit there too, right?
Yes. I believe it was 8.
Mm-hmm.
And what I'm asking is the board to allow this system to be repaired without a D-night system. The Hancocks both went to nursing homes. They were gone August and September, both, and they passed away. And therefore, no one's lived in the house, so the water hasn't been running at all. And I think that's why you might have a slight buildup in nitrates. But for a cesspool, that's about 60 feet from the well. The cesspool is uphill. I think that's pretty good reading. So that's my plea.
Okay, thank you. I'm going to turn to Matt for his report. And we'll open it up for questions.
I don't have anything to add to that. It just comes down to the question, if the board has questions about the maximum feasible compliance request.
Were you saying that the cesspool is, what's the other, upgraded from the well?
Yes.
Oh, okay.
Yeah.
How can it show that? Okay.
Yeah, it is.
And I just had another question because it was slightly different. When you were doing the maximum feasible compliance plan, and you plugged in the cost of, I think, the 2 different systems, maybe it was just unclear to me, because I think you were looking at the 10%. Like usually, I think in the past people have put in, what's the total cost of the system with D-night,
Yeah.
and then we kind of compared that to the assessed value, and it wasn't quite clear. And what you had plugged in here was 9,500 for the Singulair and 17,500.
For the event.
Yeah, and I just didn't know if you were saying that rather than giving what the total cost would be if we were applying the 10% rule. Am I being unclear? Usually you would say with D-night it's $400,000. It's like $50,000 without it.
The system without the D-night is around 25,000. So if you add the Singulair to it, plus the electrical connections and all that,
Okay, well that was the part that wasn't clear.
that'll probably add another 12,000 onto it.
Yeah,
The unit itself is 9,500, but then you gotta do the electrical connections and all that.
yeah,
So it would end up being around 35,000, 34,000.
okay. Those are my only questions about
I
that.
don't even remember what the assessed value of the house was.
It was 32.4. So if the way we've been doing it, if the D-night system was over, 32,004, it would exceed the
Yeah.
10%.
Yeah.
That just wasn't clear from the numbers, or I
The
couldn't.
D-night it would be.
Maybe other people could,
Mhm.
other members could.
Separate from that, the water analysis says it's not suitable for drinking purposes. Maybe because of the high lead content in the water. So my question is for us as a Board of Health, would we recommend to whoever is going to reside in this house about their drinking water? And what suggestions we have for any improvements that might help with that?
Yeah, so I'm not usually, I'm not familiar so much with, I know lead paint issues, but lead in
Joint.
drinking water.
It's joints, it's solid joints in the water pipes.
Mhm. So this is a problem that's not fixed by a water
Yeah.
filtration
No,
system?
not lead, no.
Yeah.
So what are their options? Just to have bottled
Haven't
water?
changed it. Generally, the solder is used in copper pipes that they used back in the day when this thing was built. That was common. So the only thing you can do is change that to PVC, or PIX they call it,
Mhm.
and get rid of that. But again, the well sat so long that you tend to build up impurities in the water, right? So,
Well, I would say then we need, so the test was, there's nobody living in it right now.
no.
Well, I would not be comfortable saying this drinking water is safe to drink without some action, or retesting at the very least. I mean, I assume that this house is for sale then?
Yes.
Or- Okay.
The problem that we have on this lot is this, if you want, and I told them to run the water, but you've only got a cesspool, so you can't run the water for 24 hours without overfilling the cesspool. The lot all pitches from the back of the property to the front, the street. So then the water's, if you use a garden hose, it's gotta go down the road. And from the time I started this work back in January, it wasn't very conducive to putting water in the street.
No,
That's the problem.
okay. Well,
So is it that we could take, action on the septic system, but then it would seem under the housing code, we could, this is with a question mark at the end of it, but we could like issue an order or make it clear that the house can't be occupied until we receive a water test that the water was potable.
yeah,
And how they go about it would just, but we would not allow the house to be occupied.
Yeah, because my concern is if it's for sale and people are buying it, they need to know that the water is not potable.
Right.
We did have one circumstance where some of these nitrate levels were this is
Yeah.
separate from the lead, but was
Right.
right at the top, and then when they retested, it was over the limit,
Right.
and they were left with that. So I have concerns about that for any prospective buyers, that they're very aware and somehow it's made clear in any transfer of property that the
Right.
water is not drinkable.
Right.
I can talk to the owner and see.
Well, I think we ought to give them, okay, sorry. No, I think we ought to give them, some official
Yeah, I
order or document, and then, although I think in the normal course, anyone who buys a house is gonna ask for a water test.
Right.
right.
So,
Not
I mean,
unless they're knowledgeable about those kinds of things, because there are a lot of people that
well,
will.
yeah.
I'm just saying in the normal course, that's why,
Yeah.
but once they have actual knowledge, because we've issued them an order.
And I will tell you that my biggest concern is if a family with children buys this house,
Yeah.
because we know how damaging lead is to children. So
Right. No, yeah.
Okay, so we have two
Separate,
issues, the septic issue and the drinking water issue. So let's address them one at a time. Septic, the big concern is we are not over the threshold yet for high nitrates. Mr. Potter's making the argument, both the fiscal argument and the fact that the water's been, the system's been dormant, that a standard septic system will be an upgrade from the cesspool for sure. So the question is that adequate, or do we want to require an IA, a DNITE system, given the expense involved? I think that's some fair summary. What's the reaction of the board? So we can move to a motion.
Well, I think so the two things, that I guess concern me is, so that the new system is also going to be up-gradient from the well, and that also that the distance is going to be down to 61 feet. And so those are two factors that would, move in the direction of requiring denitrification. But if the nitrogen limit here is really being inflated by the fact that the water, you know, no one's been using it, so for some reason that's affecting it, because we've been using 5 as the kind of limit that, you know, is a factor. But it's also over the 10%, so those are the, I don't know. So
So
I
where
think
you
we've been
coming-
holding pretty much to the 10% rule
Mhm.
or guidance. But
Well,
there
I-
are some countervailing factors here, so I guess what I'm saying.
Yep, okay. I would say that I would, to be fair to everybody else who does the maximum feasible compliance, we need to get a written quote for the standard septic system, because that field was blank in the letter, so we need to document. If we're gonna use the fiscal
Okay.
argument, we need to have better documentation, I would say. I'm on the fence about, you know, I'm concerned about the same concerns you are, so I'm on the fence on that. But we have been pretty consistent, if it's over the 10%, that's a mitigating factor.
I just wonder what the house is on the market for and whether or not that would, I know we have to look at assessed value, but we know we have assessed values and we know the market is off the roof, that this house could sell for more, and it's under the maximum feasible compliance number. It's less than. So again, I'm really concerned about the next people who come in and what they're going to be left with, because we had a circumstance that it was very difficult for the new owner.
Are you speaking about the lead, or are you speaking about the subject?
I'm talking about the nitrates. It was at under 10, but I think it was 8.9 or something. And then when they moved in and they got water testing again, it was over 10. So that family was left with more than they couldn't drink. So that's what I'm struggling with. I mean, we were a part of that decision and allowing that to happen, but then when they had the water tested, the repeating water testing, it kept coming. It was high. It was high. So that's what my concern is. I just worry about the people who
When
are coming in.
you test it again for the lead, it'll come back with a nitrate reading. What
Yeah.
the federal and state standard, EPA standard is 10. So, and it's under 10. If I had a brand new well and it come out 8, it's okay.
I know. But I worry about who's going to be buying it, what they're going to do with it. Well, I do agree that we need better documentation regarding the cost of the systems, so that we can make a determination about the maximum.
Should I use an Advantax or a single well?
Well, what we need is the basic septic system cost,
Yep.
because all you've given us is the add-on cost, and that doesn't, you know.
What
But if the septic system only costs 15,000, then we'd be done under the, that's, but we don't have that
I'll
documentation.
give it to you, no problem.
Okay, I'm sure you will.
Okay.
Not
Yeah,
a
I
problem.
mean,
Okay,
yeah.
so,
And you can get quotes from several others, I don't care, but I'm the cheapest guy around, I know that.
Are there other renovations happening to the house besides what you think
It's,
will need
it's
to go
not,
in?
it's not sold, I'm sure they're gonna
Yeah.
do, it's an old house, it's back in the 50s.
Right.
So I'm sure internally they'll probably have to do something. I don't think that's, I got no proposal for add-ons,
Right,
I don't.
yeah,
I can't find,
It's not a very big lot.
yeah.
No, 10,500 square feet.
The guy who lived there died in his 90s.
Yeah. I guess it, yeah. Yeah.
yeah, I don't,
I
I'm
mean,
not
like,
finding for
really,
sale. Okay, well,
we're just gonna come back and revisit it. I mean, there are a lot of things, and also I'm just thinking about which we haven't really talked about before, but the whole reimbursement for the
this
tax
is a
credit
different address.
thing. So, I don't know.
I was trying to find 10D Drive, and it's not coming up
What's
for
that?
sale. 10D Drive, I was looking to see if
Oh,
there was a,
Yeah,
was
yeah.
for sale, but I can't, oh, here.
So are we continuing this? Is that what we're doing until the next meeting, or?
yeah.
Okay.
I can't vote until I have more information.
Okay, well, the
Let
Zillow
me
estimate is,
know on the septic part of it, that's what I gotta do for that, and I'll give you the price. And I will take in and test the water, but I'm not gonna test the water until they have, I gotta go down to the soil, I gotta see what, the joint's gotta be lead, there's gotta be copper pipe in there.
yeah.
Or it
Okay.
could be galvanized pipe coming from the well, I don't know, that thing is old, but I doubt it's galvanized.
Okay, so that we have two options for the septic part. One is to continue for 2 weeks to get additional documentation of potentially some testing, or to make a decision contingent upon documentation that it meets fiscal constraints for maximum feasible compliance, or to require D-night. Those are the three basic options I see. Anybody prepared to make a motion?
Well,
Not.
if there was, I think that this case, if we were going to treat the 10% as guidance,
Mm-hmm.
I think that this case has a lot of factors that would go in favor of exceeding the 10%. Because at least right now, what we're looking at right now is, relatively speaking, a high nitrogen load for a system that is going to be a gradient of the well. The house is on the market to being sold. And you know that there are other costs that have to be incurred to bring the house to the market. And so I won't get into, then there's the tax credit. So I don't, so I would be inclined, I guess if we're gonna, so I'm sitting on the fence about it, but I feel like this is, if we were inclined to exceed the 10%, I think this is a good case to do it, based on the facts that are in front of us right now. Assuming, Mr. Potter's estimate, is right, that it's somewhere like 16 grand more for the D-night system. So,
Okay, so I think
I'm not making a
maybe-
motion, but I'm just putting
I
that out
think
there.
maybe what I'm
it's-
going to recommend is a 2-week continuance, because there's clearly a conflicted board. We know we need some additional documentation that maybe help us with further clarity in deciding how,
I can do that, but I'm not gonna be here in 2 weeks.
okay,
I'm gone.
good. I hope you're taking a vacation.
Maybe you'll look at another come back.
Okay, do you want to continue to, when's our
It would
next?
have to be though. In the meantime, I've gotta get a plumber in there, and I gotta look myself, get a plumber in there and see where that light's coming from.
Right, that's a separate, we're going to make a motion on that.
Yeah.
I
So-
can have the estimate to you this week.
Okay,
You can discuss it without me. It's gonna be what it is.
okay. Well, we can continue it to two weeks, and recognizing that you will not be here,
Right.
and that would be,
I can probably have my son come in, I think it's gonna
okay, that would be, well, Phil won't be here
So
in
that'd
2
be good for
weeks.
me.
Let's not come back in 2 weeks.
Okay, what would you like to do?
Discuss it in 2 weeks. I'll get my son to come
Okay. So that will be continuance to March 31st,
in. And this is regarding the septic system.
the
itself.
septic system. And we will, I think the motion for the water is to issue a letter of
Warning.
non-potability, and that, the house
That
can't
the
be
house is not,
occupied.
can't be occupied. until it's
Can't be
fixed.
occupied until that is resolved.
Right.
Okay, so let me take a motion to continue to March 31st.
So moved.
Second.
All in favor?
Aye.
We'll let you know a time, I don't know yet. And then a motion to issue a letter, whatever those standard.
Orders to correct. We call them orders to correct when they come from the housing code.
Okay, in order to correct for the water,
So moved.
lead in the water.
So moved.
Second.
All in favor? Aye. Okay. Thank you, Mr. Potter. You're coming back. Oh, yeah, okay. So, I'm sorry.
Which one, orders to correct?
Motion is in order to correct the contaminated drinking water, and then under state housing code. Okay, I'm going to call the 4:40 PM hearing with Mark Rodricks for 567C Drift Road, Brad and Sherry Amaral, 3-bedroom repair with a quick 4 on an 80,786 square foot lot. Good afternoon, Mr.
Good
Rodricks.
afternoon. We got a little more room than Mr. Potter had to deal
Yes.
with. Slightly. I'll be brief in my monologue. This is a repair of an existing system that's in failure, and it incorporates a proposed accessory dwelling unit that is shown on the plan, where one of the bedrooms in the 3-bedroom house is being reconfigured to a 2-bedroom. So I've got 2 tanks that are coming off the original structure and the proposed ADU structure that I show there. Those are both 1,000-gallon tanks. Those by gravity discharge to a second tank. It's a 2-compartment mono. The smaller compartment is to serve as the second compartment of a 2-compartment tank totaling 1,500. The 1,000-gallon compartment is serving as a pump chamber to a conventional quick 4 leaching field. The waiver that I've got here is singular, and when we work the gravity from point A to point B to get to the second tank, the depth of the inlet and outlet pipes of that second tank are less than 12 inches of separation between the high groundwater table and those pipes. The actual amount is about 1.5 inches. It is a booted monolithic tank, so this is one of them that we've encountered before. So because it's on the list, I'm here to talk to you about that. It's the only waiver associated with this repair.
Okay.
Design of the ADU is ongoing right now.
Okay,
That's all.
thank you. I'm going to turn it over to Matt.
So yeah, I've been through this a few times, and I don't see any issues with the local upgrade approval he's looking for, and the design is, Mark and I had talked about this, and I think the design is, pretty good for what it needs to be here.
Okay. You mentioned Singular? Existing Singular?
No, existing system. There's no
System,
IA
okay.
on this.
I misheard. It's like I thought.
I believe I said SAS, soil absorbent.
Maybe,
That
yeah,
is what I said.
Something's on my brain. Okay, very minor deviation. Any questions from the board?
I don't really have questions, but I think this is just, points out where the ADU and its relationship to the denaturfication, our denaturfication regs has worked itself through, which is consistent with what we heard from DEP, which is if you're not increasing the design flow of the system, they will, it's not considered new construction, and if you have a failed system that's inspected and shows failed, that you can also treat it under the maximum feasible compliance rule. You don't have to meet all the new construction standards, and so you can go through the local approval process. What I'm impressed with is that someone's going to get down and certify that the pipe is only 1.5 inches above groundwater. I want to see that measurement.
Yeah, well, we dug the test pit right there.
Yeah. So I think the only that the way they're achieving this is that they are doing a reduction of one bedroom in the existing house, and so I think that, you know, we should incorporate that in the conditions. And I don't know if, just in the normal course of things, Matt, you do an inspection before we gave like a certificate of compliance, for example, you would look at that the bedroom conversion had been completed, kind of thing?
Yeah, we'll go in, we'll request through Mark to go in and make sure that the bedroom was properly decommissioned
Right.
and it doesn't, count as a bedroom anymore.
Right.
Yep.
Exactly, so, okay. So I'm fine with it.
Okay.
I am as well. So I move that we approve the plans for 567 Drift Road, dated 1/15/25, with a variance of a reduction in the separation between the inlet and outlet pipes and tank and the high ground water table to 1.5 inches, with the following conditions: a hold harmless and a 3-bedroom deed restriction.
Second.
Motion made and seconded, all in favor?
Aye.
That's unanimous. Thank you.
Great.
Thank you, Mark. Okay, I'm gonna call the 4:50 PM variance hearing, Len Potter for 67 Ridgeline
Thanks, Mark.
Drive. Jim DiNardo, 3-bedroom repair with a quick pour on 20,000 square feet.
Double up the size of it.
Double one right up, yeah, this is easy.
That's why he needs a vacation.
Okay,
So
this is just for sieve analysis, correct?
yes. Len Potter, Westport Environmental here. Again, for James DiNardo. This is lot on 67 Ridgeline Drive. We attempted to do a purchase back in December 12th, and this lot was filled in quite extensively. If you look at the soil log, it's about 34 inches of fill, and then you got roughly 8 inches of A, and then you down to 68 with a B. Well, the water was seeping right in at the B, so there was no way to get down into the C layer at all. And so I took a sample at 83 inches. Took that sample up to the SW Coles lab, and they sieved it out, and it comes back class 2 soil, 30-minute French perfect. I've done a couple dozen at least soil samples, and Westport's class 2. I've only had one sample that whole time where we hit a sand, fine sand, that ended up being a loamy sand. But essentially our soils are class 2 soils, and this is typical of that. I have perked in this area, and it's even the 30-minute per inch, you're in the range, 20 to 30 minutes per inch on these lots. Well, that's what I get. I got a sieve analysis.
Okay. Turn to Matt.
I don't disagree, it's just, this one will require a deed restriction in Concom.
Okay.
So I'll move to approve the plan for Jim DiNardo at 67 Ridgeline Drive, a 3-bedroom repair, and a plan dated 1/29/2025, with a quick pour system, conditioned on conservation approval, a 3-bedroom deed restriction, and our approval of the sieve analysis.
Second.
Motion made and seconded to approve the project at 67 Ridgeline Drive with those conditions. All in favor?
Aye.
That's unanimous. Thank you. Thank you, Mr. Potter. Enjoy your time off.
Thanks, Len.
Okay. So we're going to return to scheduling the working meeting. So option is either before the 28th for Phil, or well, there's a small possibility of doing it right after Easter, possibly, or after May 1st. for me.
For the next meeting.
For the working
We're talking
meeting.
about the working meeting schedule. Are you with us?
Oh, you're looking at me, I'm sorry.
Yes.
Yeah, I didn't know. Yeah, no, like I said, well, I think, I just think it's probably unrealistic. Well, it depends what the agenda is. I think it's unrealistic before the 28th,
Okay,
because
that's
I think
fine.
the most interesting part of it would be what's happening with the ADUs, just in terms of substantive questions that we might need to answer, and some of which I can talk a little bit about in the update part of it. So, and I don't think there's, I guess, an urgency about the water reg stuff. It's more like, is your curiosity
Yeah.
bringing
Okay.
over to really know what's, kind of know what's going on, so.
Well, let's shoot for the first week in May. Does that make sense? We have first. Oh, wait a minute. Sorry.
So is annual town meeting, what, on May 6th?
It's the, hold on,
Oh,
it's the 6th, yeah.
And I'm off that Monday, Tuesday, Wednesday, so I won't be here the first, the 5th, 6th, or 7th.
okay, we're going to go the week after that. 18. Let's see. Oh, okay. Let me just put that in. I didn't know that. Okay,
Just
then.
trying to look when our board
So-
meetings are.
Um, So the week of the 12th is our regular Board of Health meeting. How about the week of the 19th of May?
Okay,
What, Tuesday? Tuesday the 20th of May?
in the afternoon, the morning.
I like
Oh,
morning.
the 20th, is that what you're saying, not the 19th, I'm sorry?
May 20th,
Okay,
morning?
that's a Tuesday?
Okay.
Yes.
I can't think that far ahead if it's Concom, but that doesn't strike until 7, so.
Okay, May 20th, 9, 10, what's comfortable?
10,
10 a.m.
you'll have me here if it's 10.
Okay, May 20th, 10 a.m. Okay.
Okay,
Alrighty. Save. Okay. Board member up. Let's go to the unanticipated items first, and then if we board member updates, great. Okay. Proposed mutual aid agreement for animal control between the town of Westport and the town of Dartmouth. Nick is on vacation this week, so there's no coverage, and the police department is struggling to, deal with certain issues. And Dartmouth in the past hasn't been interested, but we're hoping that they might be now. So let me turn it over to Matt.
Yeah, so the PD, I guess, had called Dartmouth, and they had stated that maybe, I wasn't part of the conversation, but what I got out of it was that they may be willing to help if there was a mutual aid agreement in place. So I drafted one over the weekend, and wanted to bring it to the board tonight to review and see if this was, something that you wanted me to move. If you guys approve it, have any questions, then I'll contact Dartmouth to see who needs to review it on their end.
It looked like a good draft to me.
Yep.
The only thing we talked about whether, we want to see, maybe it may have to be restricted to just emergencies, but for now, we'll try and see how far they're willing to go.
Yeah.
Any specific comments or concerns?
Yeah, I mean, what I mentioned to Matt was just, the mutuality of it, and, hopefully with our having, getting the temporary additional staff person, that would be good, and it'll go into FY26, but then we're on the hook too, it's like it'd be good for us, but but then we have to accept that we'll have
Yeah.
responsibilities.
Yeah, well, I think there's an ability to negotiate, if it becomes more one-sided, then there may have to be some,
Yeah,
payments made or something,
Yeah.
some negotiation there, so.
yeah, yeah.
It's certainly, I think, a really good foundation to have a negotiation over
Yeah.
and see if,
Yeah,
see if they're interested even to talk.
I think it'll benefit both Westport and Dartmouth.
yeah,
So if, the need arises on either end, it would be helpful to both of us.
yeah.
Okay,
Yeah, I think talking just to get what the realistic expectations are, given our circumstances, would be helpful. So as you were saying, yeah, it may be less run-of-the-mill, but more emergency kinds of situations.
great.
Okay.
Okay, so I would take a motion to endorse the draft mutual aid agreement and authorize Matt to negotiate with Dartmouth.
So moved.
A second.
Moved and seconded, all in favor?
Aye.
That's unanimous, thank you. Okay, town engineer job description. I kind of laid out in my email to you, this came up on very short notice last week, the day of the select board meeting. Noticed that was on the agenda, and Matt took a look at the job description and was concerned. The original draft, I believe, had lacked specificity and clarity around the responsibility of that town engineer with regard to interfacing with other boards, particularly the planning board, as well as the Board of Health and potentially Concom. At the select board meeting, Jim Whiten, I alerted him to this because I thought the way the first draft was written, it sounded like they were going to be overseeing planning board functions as well. And he concurred with that concern, and between him and Michael submitted some comments, and Jim went to the meeting and raised some of those concerns, and the board agreed to solicit feedback from the Board of Health and the Planning Board, not Concom, although Jake McGuigan had spoken up, and I thought they said Concom, but it didn't go to Concom. Michael responded back with comments from the Planning Board, which we, meaning Matt and myself, concurred with, but then we had some additional areas where we thought that it should would help clarify the responsibilities and authority. My understanding is that Jim met with Matt and Michael at the end of last week and expressed some desire or concern, wanted affirmation that the entire board was up to speed on this and sort of concurred with the edits. I don't know if that's completely accurate. I wasn't in the meeting, so let me try.
He asked if my board approved this. I said no, they didn't, but I would bring it to this meeting.
So
what are we approving?
You're just affirming basically that the edits that we recommend, the comments we made, you feel it was appropriate for us to make those comments.
Is this news to us, this position?
This position does not exist in town. It has
Right.
been advocated by, I think the infrastructure committee, because they have a number of projects, and obviously some major infrastructure projects have not gone forward. There's definitely value to having a town engineer. This person would be in the highway department, apparently, but not overseeing the highway department. I think that was the clarification that Jim made. We wanted to clarify that the responsibility was for town projects, not because the initial wording was prepares and reviews private development plans, which is plans that we see, with some articulation of functions that indicated that they would be the deciding person, and that just was a little
Bizarre.
a bridge too far. Like,
Right.
no, that's not their responsibility. We have statutory responsibility for
Right.
approving septic plans, for
That's
instance.
general.
One other area, they said the town engineer did not need to be a certified professional engineer, it was just recommended. Again, that if a town engineer is going to be doing plans for the town, they can't if they're not a PE. So that seemed to diminish the value of the position. Jim has articulated that there's not enough money to hire a PE unless we're willing to give up some of our budget to help fund it. I don't know where this is going to go, but we did submit comments to just articulate that we thought it was really important to clarify the roles and responsibilities between the various boards, and that we would love to have feedback when there's a complicated stormwater plan, or but on a request advisory basis, but not that. And Jim did articulate in that memo that the intention is not to have this person, engineer position, overseeing Board of Health functions or planning board functions, but the way it was worded was pretty unclear.
Mhm.
So we're just bringing this to you to be aware. Again, we had to get the input to the.
Seems pretty hasty, though.
Well, this has been discussed.
Yeah, it's been
But
discussed.
but we've never gotten the job description.
So whose line item is it gonna come out of, the highway department?
Yes.
Or is?
Well, I think they're going to propose. I don't know whether.
I don't know
it's-
either.
I
Because
don't
we
know.
keep hearing about money and there's not enough money, and now we're gonna hire an engineer. So I'm just curious as to where that's gonna come from.
That's not our bailiwick.
I know
but-
it's not our bailiwick, but it raises, question for me. So we're voting on the changes that you propose, or you've written.
I think the vote is to affirm that you have reviewed these edits, that, they are, reflect the concerns that the Board of Health would have, to, clarify the functions of a proposed town engineer. Whether they actually move forward, whether they have the funding, those are all decisions by the planning board. We are trying to give input. This job description was not circulated to any of the other affected boards at the time.
I just want to try to read this again.
Yeah, so what's, let's see.
It's gone through different iterations.
Yeah, I did send you the one
I
that.
know, but I didn't,
Yeah, I
because I
didn't
thought I
print it
had,
off.
because
I know.
I think Matt printed this off while I was there.
Yeah.
That's what I thought, and then.
So there are some edits, the draft that we got, there were some edits that Jim had put in around supervisory responsibility, and that it was under the direction of the administrator and select board, to clarify some
Mhm.
areas. But the essential functions was the area in particular that we were concerned about, that the way it was worded.
Well, it's really the job description that seemed to be where the focus was.
Yes, the essential
Oh, and
functions.
then the essential functions.
Because it says, for instance, directs and participates in all aspects of engineering projects from conception to completion. There's a lot of engineering projects in town. These should be town engineering
Right,
projects.
I agree, we have to put town in front of.
Yeah,
all-
and that,
in front of-
and then provides technical review of private development plans to assure compliance with town construction standards and regulations and accepted engineering
Mhm.
practices. To me, that's what the planning board does. And we, if it's related to septic. And so it's not clear, it wasn't clear. And that's why I said,
I mean, sorry.
it's appropriate for them, if we ask for a review by the engineer to help us make a decision, great. But the way it was worded, it sounds like they do it without you know,
Yeah,
and so it was just, it's not intended to change the purpose of the position or anything. It's just to clarify the roles and responsibilities in the line of,
and has Jim, is there a thing where Jim has signed off on these and he's looking for just the board's approval of it, or is it still up for this?
It is, I don't know exactly. I know he was not happy that we
Yeah,
had
I-
inserted ourselves in this
Yeah,
process.
Yeah,
And,
So we made these
So-
edits, he asked me if the board approved them. So you have the edits in front of you, and I'm asking the board to review them
Right.
if they feel like they're okay to just approve the edits.
Is it in
So-
there that it has to be a PE?
Which,
Our edits, do our edits say
yeah, we
PE?
changed it to, from preferred to special requirements.
okay, yeah.
And most of the edits, you know, the ones that are in red in the version that you have now, I don't know, are either from Jim or from Michael. And the ones where I highlighted in yellow are the ones, the additional comments we made. So we
Okay, yeah.
agreed with everything the planning board submitted in our comments, and we added a few additional comments, sort of clarifying for town projects in the definition,
Right.
deleting the approving a variety of construction permits and applications. That's not the responsibility of the town engineer. He might be submitting them, but he's not approving them because he's not an approving authority. Those kinds of things. So it's just mostly, we are adding the clarification that his purview is town projects, and then on request, support for other boards, and that we believe that it needs to be a PE. So those are that's the gist of the comments,
Right.
the additional comments we made above what the planning board submitted. I don't think we need to belabor this too much.
So
It's more just,
Yeah, yeah.
these are advisory recommendations. Whether Jim or the select board will take them is up to them, but I think it was appropriate for us to give input, and I'm gonna leave it right there, because I'm gonna say something
Yes.
I might regret.
So the only thing, and I heard from Matt about this, let me stop that. So I think putting in town is really helpful, you know, to clarify that, and I agree that we have independent authority, and it wouldn't matter whatever they wrote here, it would still ultimately be us to make decisions on separate projects and implementing our regulations. And that's really clear. Where I think that we're trying to protect ourselves from kind of a worst-case scenario, so to speak, but I think might be overstepping in some ways, is the idea that the town engineer can only, let's just say, participate in some way in our, whatever the process is, if we request it. I mean, to me, it seems like, you know, and because, you know, Matt described, you know, a scenario where it's a very intrusive relationship, where, but on the other side of it, you know, I just think that's a worst, as they say, like a worst case scenario, and it creates a, you know, I don't know, if I was a select board member and I was hiring somebody to be like kind of this, have this general oversight responsibility, in which we may be involved in town projects, that, and certainly the other agencies, but we would tell the town engineer, butt out, because we didn't ask for your opinion. We didn't ask for your advice. And that's how this reads. If we don't,
This is
if
only
we
for
don't
the
ask for
private.
it, if we don't ask for it, don't, you know,
Okay.
you don't really have a right to say, you don't really have a responsibility to come in. And I just, I'm worried about what the reaction to that would be.
Okay, the wording on that particular one is from the planning board, so
Okay,
we had slightly different language. I didn't want to have competing comments from two different boards that said very similar
Okay,
stuff.
well,
So I deferred to the planning board because they submitted their comments first.
yeah.
You're right, maybe I would have said it slightly differently, but again, I believe Jim is getting more feedback than he desires anyway, so I was trying to
Oh, I
minimize.
probably, I agree with that.
So I was just
I'm sure
trying
he
to,
is, yeah,
trying to
yeah.
highlight.
Okay, well, you asked if I had anything to
Yeah,
say.
yeah.
This is what I have to say
Yeah,
about it.
well,
I would, if I was commenting on it, I wouldn't put that prescriptive relationship in. I think that relationship has to involve, in a more working context,
I don't think
Yeah.
it's,
than necessarily saying. That's
If requested.
we're-
well, I don't know how a town engineer would know about any of our Len Potter, Mark Roderick's plans.
Well, they wouldn't, but
So-
we did, for example, we approved the septic system at the new school,
Mhm.
right? Same
Well-
might happen with the high school, same might happen, that there
Oh,
are
sure.
other projects that the town.
Well, he's
would
gonna be
do.
leading those town projects, so we would be interacting with him, yeah,
Yeah.
you're right.
You're
It's
right,
not-
but for the septic part of them, we would be saying that is, and maybe I'm just, that the school project was one, where it was our regulatory authority, so we could have rejected his advice and said, well, look, this is our call, we're gonna do this and that, but it's not a big, it's not a big deal, but I just, so,
Okay.
don't follow, you don't have to, I won't feel offended about it. I'm be curious to see whether any of the select board members who were looking at this, how they would react to it. Like we're hiring somebody, we're saying they could, yes, one of your responsibilities, is to provide advice and recommendations to regulatory boards and officials, but only if they ask for it. And that's how I read that line, and it's like, geez, okay, excuse me, kind of thing.
Okay,
But now, that's
well,
what I asked you.
again, I will just reiterate, that's the
That's-
planning
Yeah,
board
I'm just
wording.
giving you-
and
it's,
I'm
but
gonna
I don't want to
just-
override the plan. Maybe if it's coming from the planning board,
It's
maybe
coming from
they
the
have,
planning board, not
that they
us.
have more concerns about it. I'm more, if that was an issue, you would solve it in a different way.
Okay. But in general, people, it sounds like, are comfortable with the comments we submitted, and maybe have some qualms about some wording from the planning board, but that's not what's under discussion here. So I would appreciate a motion to endorse the comments we submitted.
So moved.
Second,
All in favor?
Aye.
Aye, that's unanimous. Okay, then we can confirm to Jim that the board has reviewed the comments. That was the last of the unanticipated board member updates. We have anything?
well, the only thing that I would say is, someone has asked a question whether or not this relates to ADUs. So there were two presentations, one by a representative from DEP and a consultant who was representing, who was the first time I've heard of their being involved in this. It is the Executive Office of Housing and Local Control, maybe? And so they're representing the ADU side of it, the
Affordable housing piece of it.
it's not necessarily affordable. It is, that is, ADUs are part of the state's goal to increase the housing stock,
Okay, yep.
okay? And And so there are 2 slide presentations. And I could circulate them, or Matt can circulate them to you if you just wanted to get an overview, particularly of where DEP is coming from, on how to handle the ADUs from a Title V point of view, which was helpful. The thing that is, so I forget if, no, it wasn't necessary to ask a question. The question that came up to DEP at the presentation was, well, do local boards, what about local regulations? Because the ADU statute was designed, to restrict zoning regulations that would that would restrict the the approval of ADUs, but then the statute goes on to allow for reasonable, I think it says other reasonable regulations, including Title V. And so it doesn't say anything about local regulations. So the question came up, well, what about local regulations? And thinking of denitrification. And the response from Claire Golden is so Claire's response to DEP, so Golden's response was basically, you have to consult with local counsel. The DEP is not going to answer that question. And that led me to the second set of slides, which is, the person who's representing this is a consulting firm, so this is not a member, but they're developing this office is developing its own set of regulations governing, and I won't go into the details about it, but one of the things for environmental regulation they talk about, gets into cost. They bring in, that is kind of saying that one of the prescriptions against local regulations would be, it would be not cost effective for the ADU. So I think they're looking to not allow local regulations to frustrate the intent of the state statute by imposing, a whole bunch of hoops that they have to go through, which are expensive. And so, so these regulations haven't been promulgated yet, as far as I can tell, and it's a little unclear from how they're presented whether local septic regulations would fall within it, because most of them is focused on zoning type of restrictions.
Yeah.
But I think it's just something that
We'll have to keep
we
an eye
and
on.
other communities who have adopted D9 regulations need to be cognizant of, because I think there's not going to be that many situations where people have excess capacity. There's going to be a lot more situations where
Need to add.
you need to add design capacity, and that then could be significant, because you could have not only the 1-bedroom ADU or the 2-bedroom ADU, but then you'd have to bring in the 5, and it becomes complicated from an engineering point of view too. So.
Well, we'll keep posted on. You'll keep us.
Yeah,
posted.
so we'll see what's going. And I'm thinking maybe that would be a topic at the working meeting to figure it out. I just mentioned, or that maybe because we're pushing it all the way out to May, maybe prior to the meeting, that Matt and I have that conversation with town council when the dust has settled around what these regulations are, and so we would know what to do about that part of it. So.
Well, I wouldn't be surprised if town council is developing a generalized guidance.
Yeah, yeah.
Anyway, so.
Yeah, exactly,
But,
yeah.
maybe
Yeah,
that
but
could
there are not
follow
that
up.
many communities that have this particular, you know,
Yeah. Okay, well,
anyway, so.
I'm
Yeah,
sure
well,
Matt
well.
can follow up.
Yeah, I'll see if they, what they're up to.
Okay. Thank you, Phil. Anything, Donna, you want to report on?
No, there's the work of the opioid settlement fund advisory committee continues. Even though the money that that we have has not been distributed yet, we're hoping that some will be distributed by the fall. We did spearhead Chris Herron to go to the school to speak about opioid addiction and its impact, which was the collaborative is sponsoring that and paying for that. So, and I'm working on Mental Health Awareness Month, and I'm working on trying to get some speakers to address mental health and its impact on substance use disorders, or substance use disorders impact in creating mental health issues. So I'm working on that as one of the presentations. I do have somebody who can talk about the impact of marijuana use in teens. She's actually doing research at Brown. Hopefully I'll be able to pull her in as well. That's it. That's what I have to offer.
Thank you. Been busy with Matt, but you've heard most of the updates. So I'll take a motion to adjourn.
So I move that we adjourn this meeting at 5:34 p.m.
Second.
All in favor?
Aye.
That's unanimous. Thank you very much.